Hi, I'm Yulin Hswen, Associate Editor of JAMA and JAMA Plus AI, and you are listening to JAMA AI Conversations. My guest today is Dr. Dimitri Christakis, a pediatrician and professor at the University of Washington, and the editor-in-chief of JAMA Pediatrics. He leads the Christakis Lab at Seattle Children's Research Institute and serves as the Chief Health Officer for Special Olympics International. Welcome, Dimitri.
Thanks for having me.
In your article, How Artificial Intelligence Can Promote Inclusive Health, published in JAMA Pediatrics, you explore AI's potential to enhance care for individuals with intellectual and developmental disabilities. Can you elaborate on the motivations behind writing this article and any experiences that inspired this?
Yeah, thanks. As you mentioned, I've been the Chief Health Officer now at Special Olympics for about 15 months. And before that, I've been a professor of pediatrics. I've taken care of clinical patients, including people with IDD, but I haven't really been immersed in the challenges that special population faces in accessing healthcare. And one of the things we've been doing in Special Olympics Health is screening our athletes for health issues. And I should point out that our athletes range in age from 2 to 80. So it's not purely a pediatric problem. And making referrals as needed for everything from obesity, hypertension, hearing, vision, et cetera, to their primary care providers. And what we find, and what predated my starting there, was that patients weren't following up. Our follow-up rate was very, very low, even for urgent problems, which we identify about 7% of the time, problems that we feel need to be seen within 2 weeks at the latest. And what we were hearing from our athletes was that they don't find the experience of going to their doctor particularly welcoming. And I should point out that there are many challenges that people with IDD have in accessing their physician, including, frankly, reimbursement and physicians' willingness to see them. But the most disconcerting thing was to hear from them that they find their visits to be unsatisfying. That, in fact, one grown-up said to me, "I just want to see a doctor who's happy to see me." So I likened it, and I apologize if you have any listeners who are dentists, to my going to the dentist. I put it off as long as possible. I don't find the experience particularly pleasant. And we need to do better for our athletes. And one of the things that they identified is the way they're treated, the way they're communicated with, their inability to communicate with their provider, the way their provider talks to them, et cetera. And it occurred to me that this might be an application for AI. And that was part of the inspiration for thinking about it.
You go into detail about, the relationship and the communication between patients and clinicians and the difficulty with individuals with intellectual and developmental disabilities. What is it about that communication where they feel as though they're not welcomed? And how do you think AI can really help with that?
Yeah. One of my co-authors, Wyatt Spalding, is one of our athletes, and he has IDD. And actually, his objection was that doctors talk down to him too much. Other people's objections are that doctors talk in a way that they can't understand. And other patients said that they simply don't understand what I'm trying to communicate to them, and they get frustrated with me. Presumably, part of that is because there's pressure on doctors to make the visits efficient. And there's no question that seeing someone with IDD is going to take longer than seeing a neurotypical patient. So all of these things come together, if you will, to make for an environment where there's poor quality communication and frustration, I might add, probably on both parts of the clinical encounter. Think of it like people speaking a different language. That was the way I approached it. And we've come a long way in medicine to try to have interpreted visits for people for whom English is not their first language. We need to make a similar case for people with IDD. And I should point out, because this is the other thing I think is really important about this, is that there's a concept called universal design. And I don't know how many of our listeners are familiar with that. But the general idea there is that if you design from the margins, if you make something that works for the marginal case, it works better for everybody. The best example I can think of this is a brand of kitchen utensils called OXO, which were initially developed for patients with rheumatoid arthritis or who had issues with manual manipulation. So it's a very niche population of consumers. But the products took off because, if you make a product that works well for someone that has challenges with their fingers, guess what? They work really well for someone that doesn't. And so as I thought about this problem, it's not limited to people with IDD. As physicians in general, we don't do a very good job modulating how we talk to our patients, talking to them using jargon, talking above their reading level, talking below their reading level, as Wyatt said. And I think there's a possibility that AI could fill that niche. And it won't do it on its own. It certainly won't do it to meet the needs of the 3 to 4% of people with IDD. There isn't a powerful enough business case for that, which is sad, I might add. But I think with some coaxing and maybe with the recognition that universal design would suit a much broader audience than just a subpopulation of people with IDD, there is something that could be done there. And I'm actually pleased to say that since my piece hasn't even come out yet, but in conversations with Microsoft, they've agreed to make people with IDD a subject of their hackathon, which is coming up at the end of the month, and to try to build a provisional model of such a tool. I have no idea what it will yield, but I'm excited to be participating in that, and we'll see what comes of it.
Well, I love your example about the OXO kitchen utensils because I just got them, actually, which is really funny. The tongs.
Yeah.
They're very useful. So I think that's really fascinating. I do think it is very sad because you don't actually hear about this population a lot in terms of health disparities. I think likely because they represent a very small minority. So the other stat that you wrote in the article was that only 52% of US medical schools offer formal disability awareness training.
That's right.
And that statistic is very much showcasing the need for enhanced education.
Yep.
So do you think AI plays a role in improving training for clinicians in medical school and can help with enhancing education in this area?
Look, I should have led with the fact that I am not an expert on AI. 8 months ago, I didn't even know what it was. But in thinking about it conceptually, yes, I think there is a potential role there, several potential roles. One is that the same process of bringing AI to the exam room could be brought into the medical schools, creating, if you will, simulated patients with disabilities and modulating interactions that doctors have with those patients or trainees have with those patients and giving them feedback. You spoke to that patient at a 12th grade reading level. Try to do better and give them some suggestions about how they might do it. Now, I'm speaking about intellectual developmental disability particularly because that's the special population I'm focused on. The statistic about 52% was about disabilities writ large. And if you take all disabilities, not just intellectual developmental disabilities, it's closer to 15% of the population around the world has some level of disability. Most physicians think of that in terms of physical disabilities, and I think we need training there too. But the special case of intellectual developmental disabilities continues to be overlooked. It's probably the most marginalized population in the world. Many people think of them as being invisible. And I should have also said, in terms of the disparities we see, the best available data for health disparities for people with intellectual developmental disabilities that I've been able to find anyway is actually from the National Health Service in the UK, where if you look at people with intellectual developmental disability with no comorbidity, so pure IDD, because a lot of people with IDD do have medical comorbidities, the average life expectancy is about 10 years less. And that's in a system that has universal access, universal insurance, pretty high quality healthcare. So one has to wonder what that's due to.
What I did find really fascinating was in your article, you state that you do use an AI tool to rewrite part of the article in order for a broader audience to be able to understand it. So my question is, how was that? But also, do you really think that this is something we should be doing in the future for all articles? across the JAMA network, but across other journals as well.
As an organization that champions inclusion, as Special Olympics does, we try whenever possible to make all of our communications broadly accessible because we want to reach everybody, including the population we're designed to serve. And as I was writing that article together with my co-authors, I met with Wyatt, who is, as I mentioned, one of our athletes, to make sure that he was okay with it as an author. And, what I did was that was where I had the idea, like, why don't I just give Wyatt a reading level that he can read and get the gist of this and tell me if he's okay with it. So I cut and pasted the whole article into ChatGPT and asked it to spit out a 8th grade reading level, or I think 5th grade reading level is what I asked. It didn't quite get there. I read it over to make sure it was consistent with the essential messaging, and I sent that to Wyatt for him to read over. As an editor at JAMA Pediatrics, we're always very mindful of people's use of ChatGPT. We make authors declare it. We're always worried that it's being abused. To me, this was, I hope, an appropriate use of it. And you raise a broader question of should we be doing that in general? And, I think certainly when we get to the situation where it's very easy to do so and we're convinced that there's minimal to no bias in it, I think it's a great thing to be doing. As a society, we should always aim to be more inclusive. And, I'll also point out, before I started getting into this space, I, like everybody else, came from the position that there's a huge amount of bias built into the AI models. And of course, that's true insofar as they've been trained on everything that's available in the interweb, which of course has incorporated all of the extant biases that exist globally. But the difference is, I think, that there's the real potential to build those biases out. And I can say that many of these companies are very invested in doing that. And I think it's, to me anyway, much more feasible to build bias out of an AI than it is to train it out of the many humans that have a lot of implicit and explicit bias. So I'm at least hopeful that AI in this space may be part of the solution. The point estimate of AI's promise for the future is at nil, and the 95% confidence interval goes from panacea to Armageddon. So there's a lot of unknown ahead, but I'm very pleased that JAMA is making AI in medicine a focus. And I'm very glad you're doing this podcast to spread the word.
Well, thank you very much for joining us.
It was my pleasure.
For those listeners who are planning to use AI to help with writing manuscripts, please see the JAMA guidance for use of AI by authors, which requires authors to provide the name and the version of the AI model, dates of use, prompts used, a brief description of how the AI was used, and on what portions of the manuscript, and most importantly, confirmation that the author takes responsibility for the integrity of the content generated. I am Yulin Hswen, Associate Editor at JAMA and JAMA Plus AI, and I've been speaking with Dr. Dimitri Christakis on how AI can reduce barriers for people with intellectual and developmental disabilities. You can find a link to the article in this episode's description. And for more content like this, please visit our new JAMA Plus AI channel at jamaa.org. This episode was produced by Daniel Musisi at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search for JAMA Network wherever you get your podcasts. Thanks for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.